Don't worry. Risks of concern to human health. True. Excessive and constant anxiety may have a negative impact on a person's health. Here are some common risks of persistent health anxiety. 1. Heart diseases. Chronic anxiety may increase the risk of cardiovascular disease. Anxiety can lead to high blood pressure and increased heart rate, making a person more likely to develop heart problems. 2. Mental disorders. Constant anxiety may increase the risk of developing mental disorders such as depression and other psychological disorders. Severe anxiety may be accompanied by psychological objections such as generalized anxiety and panic. 3. Digestive system problems. Chronic anxiety may affect the digestive system and increase the risk of intestinal ulcers and other digestive disorders such as irritable bowel syndrome. 4. Weak immune system. Constant anxiety can affect the immune system and make the body less able to fight infections and diseases, which increases the risk of infectious diseases. 5. Impact on sleep. Constant anxiety can cause sleep problems such as insomnia and lack of deep sleep, affecting energy and overall concentration. 6. Impact on the respiratory system. Constant anxiety can affect the respiratory system and increase the risk of developing breathing problems such as asthma, bronchitis, and difficulty breathing. 7. Chronic pain. Constant anxiety may worsen chronic pain in people with conditions such as arthritis, migraines, and muscle pain. 8. Impact on social relationships. Constant anxiety can affect social relationships and social communication. People who are constantly anxious may find it difficult to interact with others and participate in social activities. 9. Impact on general performance. Constant anxiety can affect general performance in daily life. It can be difficult to concentrate at work or study and achieve desired goals when anxiety is constantly present. 10. Harmful behaviors. Constant anxiety may cause behaviors that are harmful to health, such as excessive eating, unhealthy self-care, smoking, or substance abuse as a means of dealing with anxiety. It is essential to deal with anxiety effectively to maintain good health both mentally and physically. Anxiety management techniques such as breathing exercises, relaxation, and meditation can be used to relieve stress and anxiety. Psychological support and psychotherapy may also be helpful for people with persistent anxiety. Can you give me some tips to manage anxiety effectively? 1. Learn deep breathing techniques. Practice deep, slow breathing when you feel anxious. Sit in a quiet and comfortable place. Close your eyes and breathe deeply through the nose and hold the air for a few seconds and then release it slowly through the mouth. Repeat this technique several times until you feel relaxed. 2. Practice meditation and relaxation. Set aside time daily to practice meditation or relaxation. Use guided meditation or progressive muscle relaxation techniques to calm the mind and body and reduce stress. 3. Practice physical activity. Exercise regularly, as physical activity helps improve mood and relieve stress and anxiety. Choose the activity that suits you, whether it is walking, jogging, yoga, or any other activity you enjoy. 4. Reduce the intake of stimulants. Avoid consuming stimulants such as caffeine and alcohol, as they can increase feelings of anxiety and cause sleep disturbances. 5. Allocate time for rest and relaxation. Try to allocate time daily for your favorite activities that help you relax and unwind, such as reading, listening to music, or practicing hobbies. 6. Maintain a healthy lifestyle. Pay attention to your general lifestyle and try to get enough sleep, eat healthy and balanced meals, and adjust your schedule appropriately to avoid stress and excess fatigue. 7. Get social support. Feel free to share your feelings and experiences with friends or close family. Getting social support and talking to others may be helpful for relieving anxiety and mental fatigue. 8. Seek professional help. If anxiety is persistent and greatly affects your daily life, you may need to seek professional help through a psychiatrist or psychotherapist. Professionals in this field can provide appropriate support and guidance in learning anxiety management techniques and dealing with it effectively. Remember that each individual can differ in what works for them in managing anxiety. It may take some time and experimentation to determine which methods are most effective for you. Being willing to try different methods and techniques and find what works for you and helps you cope with anxiety healthily and effectively. 9. Identify the source of anxiety. Try to identify the main source of the anxiety you feel. Anxiety may be caused by work pressures, family problems, personal relationships, or other factors. When you know the cause of your anxiety, you can focus on dealing with it better. 10. Controlling negative thinking. Negative thinking may increase feelings of anxiety and stress. Try to be aware of negative thought patterns and try to transform them into positive thoughts. Use thought control techniques such as positive reframing and reasonable challenge of negative thoughts. 11. Create a plan. Create a plan to deal with potential sources of anxiety. The plan may include identifying practical steps you can take to solve problems or relieve stress. When you know you have a solid plan, it gives you a sense of control and reduces anxiety. 12. Communication and collaboration. Do not hesitate to ask others for help. Talking to trusted friends, seeking support in the community, or joining anxiety support groups can be helpful for dealing with anxiety. They may provide valuable advice, or discussing feelings with them can relieve emotional stress. 13. Self-care. Try to focus on taking care of yourself and your general health. Practice activities that give you an opportunity to relax and enjoy, such as relaxing, reading, writing, drawing, or any other activity that increases your psychological comfort. 14. Set healthy boundaries. Set clear boundaries for yourself and learn to accept things you cannot control. Don't take responsibility for everything and don't give yourself more than you can handle. Learn to accept things as they are and focus on what you can effectively change. 15. Maintain a balanced lifestyle. Maintain a healthy and balanced lifestyle as much as possible. Take care to eat balanced and regular meals, and be sure to get enough good sleep and rest. Do physical activity regularly and stay away from harmful behaviors such as smoking and excessive alcohol consumption. 16. Learn stress management techniques. There are many techniques that can help you manage stress and anxiety, such as guided imagery, meditation, yoga, progressive relaxation training, and reframing techniques. Try different techniques and choose the one that works best for you. 17. Avoid excessive social media use. Excessive social media use may be a factor that increases anxiety and stress. Try to reduce the time you spend on social media and make your time more effective and positive. 18. Maintain a daily routine. Create a regular daily routine that ensures stability and organization. Make time for your daily tasks, personal activities, relaxation, and physical activity. Maintaining a regular routine may help reduce anxiety and increase a sense of control. Remember that anxiety is a normal feeling that everyone can experience at some time. But if anxiety is negatively affecting your daily life and preventing you from enjoying life, you may need to seek professional help through a psychiatrist or psychotherapist.